All right, guys, how we doing? So today I want to talk about SI joint dysfunction and SI joint pain. So first, let's talk about the SI joint itself. So what is the SI joint? It's where the sacrum, the lowermost part of our spine, meets the ilium. This is part of our pelvis. This is really where the spine starts to meet with the legs, and it's a really good sturdy point for our body. So what does this also cause? It can cause a lot of pain through this joint. If we look here closely, we can see this is the sacrum, and this is the ilium, which is part of the whole pelvis, and a lot of pressure can go through this joint. Well, what kind of patients will end up having pain in the SI joint? So the types of patients we usually look for are people that have been in car accidents where there have been trauma to that joint, maybe some athletes that can get direct hits from the back of that joint. Women that have had multiple babies will have a lot of laxity in that joint. If there's a lot of laxity in that joint, it'll move a lot on you, causing inflammation, causing pain. And then lastly, there's patients that have HLA-B27 positive. It's a blood test, and it's an autoimmune disease that can cause inflammation to that joint. So what do we do for SI joint dysfunction? Well, first we'll start with physical therapy, anti-inflammatories, all that, to get the joint moving, try to see if we can decrease some of that inflammation, strengthen the muscles around it. There's a lot of muscles and ligaments that you can't see here because this is just the bone here, but there's a lot of muscles and ligaments that come around here and stabilize this joint. And the anti-inflammatory medication will help decrease the inflammation actually inside the joint. If that doesn't work, the next step would be to do an SI joint injection. And in that injection, we put a needle, very simply, we come right across, go right past the ilium into the SI joint, and we'll put some steroids and some numbing medication into that joint. Now, if that works really well, but sometimes it could wear off, we can do something called an SI joint fusion. And we do these from the posterior aspect. There is a way to do it from the lateral aspect as well. A little more invasive, a little more risky, but posterior aspect is very less invasive, a lot less risky. We stay away from the nerves, stay away from all the blood vessels. The way we do this is patients lie on their belly, we make a small incision, and we drop straight down into the SI joint with a pin, and then we dilate until we have a working cannula about that wide. And then through that working cannula, we put a little dowel into that joint, and that dowel will be coated with some DBM or some bone marrow to help create a stabilization of this joint. So that's all we're trying to do with the SI joint is stabilize it. Keep it from moving, keep it from developing that inflammation. So these patients, what kind of patients are out there that you're gonna see? They're gonna have pain in this distribution, usually right over the SI joints, especially if you push right on there, the patient will have a lot of pain. And then also the pain can radiate down the legs as well. It can go to the posterior aspect of the thigh, even sometimes down past the feet. So that's a little brief overview of SI joint dysfunction and how we treat it here at Cantor Spine.